Hello, my name is Joshua Mugabe. I welcome you to Endocrine System. What is the difference between the endocrine gland and exocrine gland? Endocrine gland is a gland whose secretion, called the hormone, is collected by the blood and reaches tissues through the circulation. Hypophysis, which we call the pituitary, and adrenals are examples of endocrine glands. Exocrine glands, these are glands whose secretion are released externally through ducts into the skin, intestinal lumen, or mouth, etc. The sebaceous gland and the salivary glands are examples of exocrine glands. What is the constitution of the endocrine system? The endocrine system is constituted of the endocrine glands and the hormones they secrete. What is the historical nature of the glands and how are they formed? The glands are epithelial tissues. They are made of epithelium. During the embryonic development, invaginated into the tissues. In the exocrine glands, invagination has preserved the secretion ducts. And the endocrine glands, the invagination is complete and there are no secretion ducts. Why is the endocrine system considered one of the integrative systems of the body? What is the other physiological system also has this function? The endocrine system is said to be integrative character since hormones produced by the endocrine glands are substances that act at a distance, and many of them act in different organs of the body. So the endocrine gland receives information from some regions of the body and they can produce effect in other regions, providing functional integration of the body. Beside the endocrine system, other physiological system that also has integrative function is the nervous system. The nervous system integrates the body through the network of nerves connected to the central and peripheral neurons. The endocrine system integrates the body through hormones that travel through the circulation and are produced by the endocrine glands. What are hormones? Hormones, these are substances secreted by the endocrine gland and collected by the circulation that acts to produce effect upon specific organs and tissues. Hormones are effectors of the endocrine systems. What are target organs of the hormones? Target organs, target tissues, target cell are those specific organs, tissue, and cell upon which each hormone acts and produces its effects. Hormones selectively act upon their target due to specific receptor proteins present in those targets. How does the circulatory system participate in the function of the endocrine system? The circulatory system is fundamental for the functioning of the endocrine system. The blood collects the hormones made by the endocrine glands. Through the circulation, these hormones reach their targets. Without the circulatory system, the action at the distance characteristic of the endocrine system would not be possible. Are hormones only proteins? Some hormones are proteins like insulin, glucagon, and ADH, and others are derived from proteins, modified amino acids, like adrenaline and noradrenaline. Others are steroids, like cholesteroloids and estrogen. What are the main endocrine glands in the human body? The main endocrine gland in the human body are the pineal glands, or the pineal body, hypophysis, what we call the pituitary, the thyroid, parathyroids, the endocrine part of the pancreas, the adrenals, the gonads, those are testicles and ovaries. 150 other organs like the kidneys, the heart, and placenta also have endocrine functions. What is the pineal gland? The pineal gland is also known as the pineal body or epiphysis. Is situated centrally in the head. It secretes hormone melatonin, hormone produced at night and related to the regulation of the circadian rhythm, the circadian cycle, the wakefulness sleep cycle. Melatonin possibly regulates many body functions related to night-day alternation. What is the osseous cavity where the pituitary gland is located? The pituitary gland or hypophysis is located in the sella tunica of the sphenoid bone, one of the bones in the base of the skull. So the gland is situated within the head. What are the main divisions of the hypophysis and what are their functions? The Hypophysis, or what we call the pituitary gland, is divided into two portions: the endon of hypophysis and anterior hypophysis, and the neurohypophysis or posterior hypophysis. In the adenohypophysis, two hormones that act directly on the growth hormone and the prolactin. The four tropical hormones, like the hormones that regulate other endocrine glands, adrenocortical hormone, ACTH, thyroid stimulating hormone, TSH, luteinizing hormone, LH, and follicle stimulating hormone, FSH, are produced. The neurohypophysis stores and releases two hormones produced by a hypothalamus: oxytocin and antidiuretic hormone, ADH, or vasopressin. What is the relationship between the hypothalamus and the hypophysis? The hypothalamus is part of the brain situated just above the hypophysis. The hypothalamus gets peripheral and central neuron impulses that trigger response to its neurosecretory cells. The axon of these cells go down the adenohypophysis to regulate hypophyseal secretion by means of negative feedback. When the plasma leaves, the adenohypophyseal hormones are too high. The hypothalamus detects the information and commands the interruption in the production of the hormone. If the blood level of the adenohypophyseal hormone is low, the hypothalamus stimulates the secretion of the hormone. Hypothalamic cells produce hormones released by the neurohypophysis. These hormones are transported by their axon to the hypophysis and then released in the circulation. What are the hormones secreted by the adenophosphase, and what is the respective function? Adenohypophysis secretes growth hormones, prolactin, adenocortical hormone, thyroid stimulating hormone, follicle stimulating hormone, and luteinizing hormone. Growth hormone is also known as somatotrophic hormone, STH, which acts upon the bones, the cartilages, and muscles, promoting growth of these tissues. Prolactin is a hormone that in women stimulates the production and secretion of milk by the mammary gland. The ACTH is the hormone that stimulates the cortical portion of the adrenal gland to produce and secrete the cortical hormones, glucocorticoids. TSH is the hormone that stimulates the activity of the thyroid gland, increasing the production and secretion of its hormone T3 and T4. follicle-stimulating hormone is a gonadotrophic hormone. That is, it stimulates the gonads in the women to act upon the ovaries, inducing the growth of the follicles, and in men it stimulates spermatogenesis. The luteinizing hormone is also a gonadotrophic hormone. It acts upon the ovaries of women, stimulating ovulation and formation of the corpus luteum, which secretes estrogen, and in men upon the testes to stimulate the production of testosterone. What is the relation between the thyroid and the hypophysis? Hypophysis secretes TSH, thyroid stimulating hormone. This hormone hastens the secretion of thyroid hormone, triiodothyroid, and thyroxine, or T3 and T4. When the plasma concentration of thyroid hormone is high, this information is detected by the hypothalamus and by the hypophysis, and this gland reduces the TSH secretion. When the thyroid hormone levels are low, the TSH secretion increases. It is thus a negative feedback. Injuries of the hypophysis that cause TSH hyposecretion, for example, in case of tissue destruction, or hypersecretion in case of excessive cell purification or cancer, can change the function of the thyroid gland completely. What are some diseases caused by abnormal growth hormone secretion by the hypophysis? In childhood deficiency, growth hormone secretion may lead to delayed growth, and in severe cases, to nanism, that is dwarfism. Excessive production of growth hormone in children may cause exaggerated osseous growth and gigantism. In adults, growth hormone excess, for example, in hypophyseal cancer or in people that wrongly ingest growth hormones as nutrition supplements, may lead to acromegaly, that is excessive and disproportional growth of the bone extremities like the skull, maxillaries, and the hands and the feet. What are the target tissue, target organs of adenohypophyseal hormone? Growth hormone, bones, cartilage, muscles, prolactin, mammary glands, ACTH, cortical portion of the adrenals, TSH, thyroid glands, follicle stimulating hormone and luteinizing hormone, ovaries, and testicles. What are the hormones secreted by the neurohypophysis? What are their respective functions? Neurohypophysis secretes oxytocin and the antidiuretic hormone, ADH. Oxytocin is secreted in women during delivery to increase the strength and frequency of the uterine contraction and to help in the birth of the baby. During lactation period, the infant's sucking action on the mother's nipple stimulates the production of oxytocin that increases the secretion of milk by the mammary glands. Vasopressin or antidiuretic hormone. This participates in water regulation of the body and thus in control of the blood pressure, since it allows the reabsorption of free water through the renal tubules. Water goes back to the circulation, the blood volume increases. What is the difference between diabetic mellitus and diabetic insipidus? What are the characteristics, signs of diabetic insipidus? Diabetic mellitus is a disease caused by deficiency of insulin secretion by the pancreas, or by impaired capturing of this hormone by the cells. Insipidus diabetes is a disease caused by deficiency of antidiuretic hormone, a secretion by the pituitary gland, or also impaired sensitivity of the kidneys to this hormone. In diabetes insipidus, blood lacks ADH, and so tubular reabsorption of water in the kidney is reduced. A great volume of urine is produced. The patient urinates a lot and many times a day, a sign also accompanied by polydiphysia, an increased thirsty and exaggerated ingestion of water, and sometimes by dehydration. What does the urine volume increase when alcoholic beverages are ingested? Alcohol inhibits that ADH antidiuretic hormone secretion by the hypophysis. Low ADH reduces tubular reabsorption of water in the kidney, and thus urine volume will increase. What are the target organs and target tissue of the neurohypophysis? The target organ of oxytocin are the uterus and the mammary glands. The target organ of ADH are the kidneys. Where in the body is the thyroid gland located? The thyroid is located in the anterior cervical region or the frontal neck, in front of the trachea, just below the larynx. It is bilobated mass below the Adam's apple. What are the hormones secreted by the thyroid gland? What are their functions? The thyroid secretes hormone thyroxine T4 and triiodothyroxine T3 and calcitonin. T3 and T4 are iodinated substances derived from amino acid tyrosine. They act to increase cellular metabolic rate of the body, that is cellular respiration, metabolism of proteins, lipids, and many others. Calcitonin inhibits the release of calcium cations by bones, thus controlling the blood level of calcium. Why is the dietary obtained of iodine so important for thyroid functioning? The obtained iodine from the diet is important for thyroid because this chemical element is necessary for the synthesis of thyroid hormone T3 and T4. The iodine supply often comes from the diet. What is a goiter? What is endemic goiter? How is this problem socially solved? Goiter, this is the abnormal enlargement of the thyroid gland. The goiter appears as a tumor in the anterior neck, and it may be visible or sometimes not visible, but palpable. Goiter can occur in the hypothyroidism or in hyperthyroidism. Endemic goiter is the goiter caused by deficiency of iodine ingestion, deficiency of iodine in the diet. The endemic character of the disease is explained because iodine content of the diet is often a social or cultural condition affecting many people of the same geographical region. The hypothyroidism caused by deficient iodine ingestion is more frequent in regions far from the sea coast, since seafood is rich in iodine. Nowadays, the problem is often solved by obligatory addition of iodine in table salts. As the table salt is widely used, fundamentally the supply of iodine in diet is also assured by this method. What happens to the thyroid stimulating hormone blood level in hypothyroidism? Why is there enlargement of the thyroid in the endemic goiter disease? When there is low Ta3 and T4 secretion, the thyroid stimulating hormone secretion by the hypophysis is very stimulated, and the thyroid stimulating hormone level in blood increases. The increase in the thyroid-stimulating hormone availability promotes the enlargement of the thyroid gland. The thyroid enlargement is a reaction of the tissue that tries to compensate for the functional deficiency by making the gland increase in its size. What are some signs and symptoms found in patients with hyperthyroidism? The hormones made by the thyroid gland stimulate the basal metabolism of the body. In hypothyroidism, there is abnormally high production and secretion of T3 and T4. So the basal metabolic rate is increased. The signs of this condition may be tachycardia, abnormal high heart rate, weight loss, excessive heat sensation, excessive sweating, anxiety, and so on. One of the typical signs of hyperthyroidism is exophthalmos, protrusion of the eyeballs. Generally, the patient also presents goiter. What are some signs and symptoms found in the patient with hypothyroidism? Hypothyroidism is the production and secretion of T3 and T4 are impaired. Since these thyroid hormones stimulate the basal metabolism of the body, that is cellular respiration, fatty acids, protein metabolism, and so on. The patient with hypothyroidism may present bradycardia, that is low heart rate, low respiratory rate, excessive tiredness, depression, cold intolerance, weight gain. Hypothyroidism is normally accompanied by goiter, enlargement of the thyroid gland in the neck. What is the physiological cause of the syndrome known as cretinism? Cretinism is caused by chronic deficiency of thyroid hormones T3 and T4 during childhood. The chronic hypothyroidism during childhood may cause retardation and lost structures due to low basal metabolic rate in the period of life when growth and development of mind faculties occur. What are the parathyroids? Where are they located? And what are the hormones secreted by these glands? Parathyroids are four small glands embedded, two in each posterior face of one thyroid lobe. Parathyroids secrete parathormone, a hormone that, together with calcitonin and vitamin D, regulate the calcium blood level. What is the relationship between the secretion of parathormone and calcitonin blood level, calcium blood level? Parathormone increases the calcium blood level since it stimulates reabsorption, remodulation of the osseous tissue. when the osteoclast remodeler burns calcium is released in the circulation. What is a mixed gland? Why is the pancreas considered a mixed gland? A mixed gland is a gland that produces endocrine and exocrine secretion. Pancreas is an example of a mixed gland because it secretes hormones in the circulation, like insulin and glucagon. But it also releases exocrine secretion, the pancreatic juice. Parathormone also acts increasing on calcium absorption in the intestine by vitamin D activation. It acts in the kidneys, promoting tubular calcium reabsorption too. What are the pancreatic tissues involved respectively in exocrine and endocrine secretion? What are their respective hormones and enzymes? The exocrine secretion of the pancreas is produced by the pancreatic acin, aggregate of secretory cells that surround the small exocrine ducts. Exocrine pancreas secretes digestive enzymes, the pancreatic juice, amylase, lipase, trypsin, chymotrypsin, carboxypeptidase, ribonuclease, deoxyribonuclease, lactase, and gelatinase. The endocrine secretion of the pancreas produced and secreted by small glands of cells dispersed throughout the organ called isolates of Langerhans. The isolates make insulin, glucagon, and somatostatin. What is the importance of the glucose blood level in human health? The glucose blood level, glycemia, must be kept normal. If it is abnormally low, there is not enough glucose to supply energetic metabolism of the cell. If it is abnormally high, it causes severe harm to the peripheral nerves, the skin, and the retina, the kidneys, and other important organs. It may predispose to cardiovascular disease, acute myocardial infarction, stroke, thrombosis. If it is actually too high, medical emergency like diabetic ketoacidosis and hypoglycemia, hyposomonal state may occur. What are the functions of insulin and glucagon for the blood glucose control? Glucagon increases glycemia and insulin reduces it. They are antagonistic pancreatic hormones. Glucagon acts stimulating glycogenolysis and thus forming glucose from glycogen. Insulin is a hormone responsible for the entrance of glucose from the blood into the cells. Glycemia is low, for example during fasting. Glucagon is secreted and insulin is inhibited. Glycemia is high, that is after the meals. There are inhibition of glucagon and more secretion of insulin. What are the target organs upon which insulin and glucagon act? Glucagon mainly acts upon the liver. Insulin is generally upon all cells. Both also act upon the adipose tissue, respectively, stimulating glucagon and inhibiting insulin. The use of fatty acid in energetic metabolism, an alternative path of energetic metabolism, is activated when there is shortage of glucose. What are the effects of somatostatins for the pancreatic hormone secretion? Somatostatins inhibits both insulin and glucagon in secretion. What is diabetes mellitus? Diabetes mellitus is a disease caused by deficient production and action of insulin, and consequently low glucose uptake by the cells and high blood glucose level. What are the three main signs of diabetes? The three main signs of diabetes mellitus are also known as diabetes triad: polyuria, polydipsia, and polyphagia. Polyuria is the excessive elimination of urine. In diabetes, it is caused by reduced water reabsorption in the renal tubule due to increased osmolality and glomerular filtrate caused by excessive glucose. Polydipsia is the exaggerated ingestion of water. The thirst is due to excessive water loss in the urine. Polyphagia is the exaggerated ingestion of food caused by deficiency of energy generation by glucose-lacking cells. Why do diabetic patients often undergo dietary sugar restriction? What are the main complications of diabetes mellitus? Diabetes patients often are advised to ingest less carbohydrates since these substances are degraded into glucose, and this molecule is absorbed in the intestines. The dietary sugar restriction goal is to control glycemia, to maintain it at a normal level. The main complications of diabetes are the tissue injuries that occur in various organs caused by chronic increase in blood osmolality. The peripheral nerves, diabetic neuropathy, resulting in sensitivity loss, increased wounds. A person does not feel that the tissue is being wounded and wound expands. Muscle fatigue in the kidneys, diabetic neuropathy, causing glomerular lesions and may lead to renal failure. In the retina, diabetic retinopathy leading to visual impairment and blindness. In the skin, as a consequence of neuropathy. Diabetes mellitus also is one of the major risk factors for cardiovascular disease like embolism, myocardial infarction, and stroke. What is the difference between the type 1 diabetes mellitus and type 2 diabetes mellitus? Type 1 diabetes, also known as juvenile diabetes or insulin-dependent diabetes. This name is not adequate for type 2 diabetes and may become insulin-dependent. Is the impaired production of insulin by the pancreas, believed to be caused by destruction of the cells of isolates of Langerhans by autoantibodies or autoimmunity. Type 2 diabetes occurs in adult individuals. It is often diagnosed in people more advanced age. In type 2 diabetes, there is normal and low secretion of insulin by the pancreas. But the main cause of the high glycemia is the peripheral resistance of the cells to the action of the hormones. In the ancient Greece, the father of medicine, Hippocrates, described a method of diagnosing diabetes mellitus using testing the patient's urine. What is the physiological explanation for this archaic method? Under normal condition, glucose filtered by the renal glomerula is almost entirely reabsorbed in the nephron tubules and not excreted in urine. With elevated glucose blood level, the renal tubules cannot reabsorb all the filtered glucose, and some amount of the substance appears in the urine. This amount is enough to provide a sweet taste that helped Hippocrates diagnose diabetes and to differentiate it from the disease accompanied by polyuria. Nowadays, the method is inconceivable due to the danger of contamination of the tester by the disease agents possibly present in the patient's urine. What are the main treatments of diabetes mellitus? The general goal of diabetes treatment is to maintain a normal glycemic levels. Type 1 diabetes is treated by parenteral administration of insulin. Insulin must be administered intravenously or intramuscularly because as a protein it would be digested if ingested orally. The type 2 diabetes treatment is done with oral drugs that regulate the glucose metabolism and in more severe cases with parenteral administration of insulin. The modulation of carbohydrate ingestion is an important aid to diabetes treatment. Diabetes treatment with the use of hypoglycemic agents like insulin or medicine must be carefully and medically supervised, since if wrongly used, the drugs may abruptly decrease the glucose blood level, causing hypoglycemia, even death. Many other forms of diabetes treatment are under research worldwide. How can bacteria produce human insulin on an industrial scale? What other forms of insulin made available by the pharmaceutical industries? Bacteria do not actually synthesize insulin. It is possible, however, to implant human genetic material containing insulin gene into the bacterial DNA. The mutant bacteria then multiply and produces human insulin. Insulin is also isolated and purified for later commercialization. This biotechnology is known as recombinant DNA technology. Besides human insulin, the pharmaceutical industry also produces insulin to be used by humans, made from the pancreas of pigs and cows. What are the adrenal glands located and how many are they, and what are their portions? Each adrenal gland is located on the top of each kidney, forming a heart-like structure for the kidney. So there are two glands. Adrenal parenchyma tissue is divided into two portions. The most peripheral is the cortical portion, or adrenal cortex, and the central is the medullary portion, or the medulla, adrenal medulla. What are the hormones secreted by the adrenal medulla and their respective functions? The medullary portion of the adrenal secretes hormone catecholamine, a group of adrenaline, also known as epinephrine or noradrenaline, also known as norepinephrine. Besides their hormonal function, adrenaline and noradrenaline act as neurotransmitters too. Neurons that use them as neurotransmitters are called adrenergic neurons. Adrenaline increases glycogen breaking into glucose, glycogenolysis, thus increasing glycemia and the basal metabolic rate in the body. Adrenaline and noradrenaline are released during situation of danger, that is fight, or flight response. And they intensify the strength and the rate of the heartbeat selectively, modulate the blood origination and some tissues by secrete selective vasodilation and selective vasoconstriction. By vasodilation, they increase the blood supply to the brain, the muscles, and the heart. By vasoconstriction, they reduce the blood supply to the kidney, the skin, and gastrointestinal tract. Substances like adrenaline and noradrenaline that promote vasodilation and vasoconstriction are called vasoactive substances. What are the hormones secreted by adrenal cortex and their respective functions? The cortical portion of the adrenal secretes hormone corticosteroid, derived from cholesterol and glucocorticoid, mineralocorticoids, and the corticosex hormones. Glucocorticoids and cortisol and cortisone. The glucocorticoids stimulate the formation of glucose from degradation of proteins of the muscle tissue, glucogenesis, and so they help to increase glycemia. The hormones play an important immunosuppressant role, that is, they reduce the action of the immune system, and for this reason they are used as medicine to treat inflammatory and autoimmune diseases and rejection of transplanted organs. The mineralocorticoid aldosterone and the oxycorticosterone regulate sodium and potassium blood concentration, and thus they control the water level and extra cells. Aldosterone increases the sodium reabsorption and thus water reabsorption in the renal tubules, and it also stimulates the renal excretion of potassium and hydrogen ions. The adrenocorticosex hormone are androgen, male sex hormone present in men and women. In men, their main site of production is the testicle, and they promote the appearance of secondary male sex characteristics like body hair, beards, deep voice, male pattern of fatty distribution, maturation of the genitalia. If abnormally high in women, they caused inhibited maturation of the female genitalia, disturbance of the menstrual cycle. Why are glucocorticoids used in transporting patients? Patients with transplanted organs are prone to host versus grafted rejection, since their immune system tends to attack the grafted organ because of recognition of the grafted tissue as foreign matter. The prevention and treatment of the common problem prevents the early given glucocorticoids and other immunosuppressants. Glucocorticoids have an immune suppressant action, and so they reduce aggression of the human system against the graft. The immune action, however, is also very important for the individual. Immune system defends the body against invasion and infection. by pathogenic agents, the virus, bacteria, and toxins, besides being fundamental for the elimination of modified cells that may proliferate and cause cover. Patients receiving immunosuppressants like glucocorticoids are under increased risk of infection and neuroplastic diseases. What are the hormones produced by the testicles and the ovaries? The testicles make androgenic hormones, the many of them being the testosterone. The ovaries carries extremely estrogen and progesterone. What is the endocrine function of the placenta? The placenta is non-permanent gland of the endocrine system, but it also has endocrine secretion. Also, the placenta produces estrogen and progesterone. It also secretes human choric gonadotrophin, HCG, that acts similarly to the hypophysis. Human placental lactogen, similar to prolactin and stimulant of the mammary glands and the series of hormonal glands, since to the hormones of hypothalamus and hypophysis axis. Thank you very much for participating in the endocrine system. Please do like, share, and subscribe.